She was described as an amazing midwife, and they wanted to give her an amazing send-off. The funeral of Safa Alam, who's aged just 29. She's one of over 100 frontline hospital workers from a minority ethnic background who have lost their lives during this pandemic.
Death is something that we are quite used to, but not like this. This is death after death.
A month ago, NHS England stated that emerging UK and international data suggested people from black and minority ethnic backgrounds were being disproportionately affected by COVID-19. But since then, has enough been done to protect their workers?
For some reason, COVID deaths affecting our BAME clinical colleagues and health workers seems to have become an acceptable occupational hazard.
Back in April, it was acknowledged that many BAME staff were feeling anxious and stressed. Some had reported having difficulty accessing PPE. A programme of work was established to help keep BAME staff safe. It stated that NHS employers had been tasked with providing guidance on enhanced risk assessments and, if necessary, BAME staff should be removed from the front line and redeployed elsewhere. Channel 4 News has surveyed hospital workers to find out in the weeks since this guidance was published how much of it has been enacted.
My name is Dr. Asif Munaf. I work as a medical registrar working on a COVID ward. I've had ex-colleagues who have passed away, unfortunately, and the last few weeks have been, to a certain extent, quite terrifying.
Dr. Munaf works on COVID wards across several different trusts in the Midlands. He has been emailed to say that BAME staff should be risk assessed, but says no action has been taken.
There's nothing concrete there. It does say there will be preferential COVID testing for BAME staff on their households, but that's not been rolled out. So when it comes to something that's supposed to be done and actually it's not been done, that does cause a bit of dismay and people to be disillusioned and demoralised.
He isn't alone in his concerns. Channel 4 News has conducted a survey of NHS employees working in hospitals and found some alarming results. Asked whether they'd been presented with a risk assessment, 73% said no or that it was inadequate. 67% said their trust hadn't done enough to make them feel safe. And 61% said they don't have equal access to PPE. 62% said they feel they can't refuse to work even if they don't feel safe.
My name is Nicole McIntosh. I have worked in the NHS for over 20 years. What we've been doing is deploying staff, returners back to the front line as part of the COVID response. And we call it the front line deliberately because it's a battle. So I feel strongly that if people are giving their lives as they have been from a BAME background especially, that the least we can do is to risk assess and take appropriate action.
Mrs. McIntosh says she's not surprised by our findings. Many of the nurses she mentors have been told it's up to them to request a risk assessment, but many are too worried about their position to speak out.
I think that we need to use COVID as a paradigm shift for how we look at race in the NHS in terms of things that were happening all along and were quietly accepted will not be accepted anymore. So for me, hearing that people from a BAME background haven't had a risk assessment or it has been a tick box exercise doesn't surprise me. But it really needs to be a wake-up call for the leaders.
And that message for NHS leaders was echoed in our findings. Over half of those we surveyed said they felt pressured into frontline work. Many compared their treatment with white counterparts. This is just some of what they told us.
Lots of my white colleagues have gone off sick, are self-isolating or acting as coordinators within departments.
We are often portrayed as weak, lazy or not pulling our weight if we raise any of the issues.
Many BAME are yet to gain the unseen, unheard, lower class, yet many risk their lives to save the nation.
But none of this should come as a surprise to the NHS. Their own yearly reports into race equality have shown that BAME staff are significantly underrepresented in senior positions, and this can make speaking up more difficult. A number of medics are now increasingly critical about what they see as a lack of action.
My name's Jawad Amin. I'm a general practitioner, and my concern is the disproportionate number of BAME deaths affecting our clinical colleagues and health workers. If this was any other time, even if one person died at work, there'd be a full investigation by the Health and Safety Executive, and the lawyers and the media would be all over it.
In response to our survey, NHS England told us that trusts should be prioritising risk assessments for their BAME staff, in line with guidance from NHS employers, and that they're continuing to listen to workers. Our findings suggest many feel they're still not being heard, as they continue to put themselves at risk every day. Darshna Soni, Channel 4 News.